So in the case of sickle cell anemia, their shape is no longer correct, and that's going to obviously affect their how they function. White blood cell count, um, again, looking at the number of white blood cells. Medical procedures, so we can do a white blood cell differential or white blood cell diff. Again, looking at the 5 different kinds of white blood cells that we have, seeing if the numbers are normal. If they're not, it can tell us that there's a bacterial infection or a fungal infection or inflammatory response going on somewhere. Again, not very specific, but it gets us a starting point for something. Bone marrow aspiration would be where they stick the giant needle in your hip and take out bone marrow. This needle has to go through the bone. Very painful procedure. And then sucks out bone marrow, and then they can look at that to see if uh, what exactly is wrong. So you could determine leukemia from that because the bone marrow is putting out uh, dysfunctional white blood cells, or the aplastic anemia is where they your bone marrow was just not producing very good blood cells to begin with. So phlebotomy, phlebo is talking about vein. So this is a incision into the vein in order to remove blood. This sounds like something complicated, but this is literally just somebody's drawing your blood. So you go to the doctor, they need to draw labs, they draw your blood, that's called phlebotomy or a venipuncture. Um, Again, the uh, definition makes it sound a lot more complicated than it really is, though. So therapeutic procedures, it's not just the ones we use to diagnose, but the ones we use to treat. So we have different kind of transfusion and transplants that we have going on. So autologous transfusions are going to be those where um, you're going to take it from the patient's own body. So you collect and store the patient's own blood until they may need it. So uh, I know in principles we discussed this. I know we haven't discussed this here in MedTerm, but there are Jehovah's Witnesses that do not accept blood products from anybody. That's just part of their religious beliefs. Um, so if they're going to have a procedure done where they may lose a lot of blood, what they can do is actually donate their own blood, and then the hospital would keep it. So when they get done with the surgical procedure, if they do need blood, they can just get their own blood back. They're okay with that. They don't want anybody else's blood within their blood. Then we have such things as blood transfusions, which we talked about when we discussed which bloods are compatible with one another. So that would be picking blood from one person and putting it in somebody else's. Bone marrow transplant is once you suck the bone marrow out through the aspiration, you can actually donate that to somebody else. So the way this works, people that have cancer, you completely destroy their bone marrow by using chemotherapy and radiation, and you actually kill all of their bone marrow, and then you put in somebody else's bone marrow to hopefully cure the cancer. But sometimes that does not work. But that's a bone marrow transplant. Then we have the homologous transfusion, and so that's going to be getting blood from somebody else. So where these autologous was one where it's just your own blood being transferred back to you. Homologous is going to be like if I donated blood to one of you guys versus you just getting your own stuff back. So one of the things that you can donate is what's called packed red blood cells. So this is literally a bag of blood, but it's just the red blood cells. You take the plasma, you take out the white blood cells, you take out platelets, everything else. So it's just red blood cells that are being transfused to somebody else instead of the whole blood content, which is at the bottom of the page that we're going to discuss in a second. Plasmapheresis is where they actually, sometimes you hear about people just donating plasma versus actually donating blood. So the procedure is still kind of the same as when you donate blood. They take your blood out, except this gets run through a machine and it'll separate the plasma from red blood cells. I mean, the plasma from everything else. They put the everything else back into you, but they keep the plasma, and then you donate that part. So again, you're donating the liquid portion that everything is dissolved in to somebody. And whole blood is when you are talking about everything. So plasma, red blood cells, white blood cells, platelets, everybody. So we get into the pharmacology. We kind of hinted around to some of this before. So you have an anticoagulant, which is something that's going to prevent a blood clot from forming. They can be also called blood thinners. So some people have conditions where they will clot blood very easily, especially like people who have transplanted organs or artificial heart valves, things like that. They're more likely to clot very easily. So we put them on anticoagulants. Some of those examples are heparin, warfarin, and Coumadin. And so those will make you take a longer time in order for blood to clot. We're going to look at the prothrombin time to make sure that it's not overly so, because you don't want to fall and hit something and then bleed out just because you skinned your knee because you're on too much of the anticoagulant. So we really have to keep a good eye on that. An antihemorrhagic is something that's going to actually stop or actually cause blood to clot more. So if somebody gets too high of a dose of warfarin, the thing that we give them in order to help them stop bleeding is vitamin K. And vitamin K will reverse those effects. And so these two work in opposite. You have an anticoagulant, antihemorrhagic, and they complement one another because they'll fix the problem of the other. Antiplatelet agents are those that are going to interfere with the action of platelets, kind of help them prevent them from sticking together. So this is also going to prolong bleeding time. They're going to help prevent for heart attacks and strokes because a lot of those are caused by blood clots. And an example of this would be Plavix. Then we have a hematinic, a substance that increases the number of erythrocytes or the amount of hemoglobin in the blood. So, maybe you have a trouble producing enough red blood cells, but it's not due to your iron or your iron is low or that your vitamin B12 is low, but you don't have enough stuff to put everything together. So an example of that drug is called Procrit, which makes sense. So pro meaning like that you want it to happen, and crit like hematocrit. That's how they got the name. They're very cute with how they come up with these things. Then we have a thrombolytic, which is going to dissolve clots. We talked about this when we discussed cardiovascular issues. So you have people that have strokes and things like that, and you can give them the TPA, which was that plasminogen